Finding a family doctor has become more and more difficult, but it's the first step towards consistent and personalized health care. Dr. Ahmed Samy from Samy's Clinics is here with more. Samy, good morning.
Good morning, Rick. Thank you very much for having me. It's a pleasure.
Why do we have such a shortage of family doctors?
That's a very good question, actually. It's due to a lot of reasons and factors. One of them, the baby boomers. Actually, we have an aging population, which is getting bigger and bigger, and a lot of also retiring doctors at the same time. And there was a little bit of complications to be a family doctor in Ontario. That's all kind of really come together as a lot of reasons to have this kind of problem.
So what's the impact? Obviously, people are not getting the care that they need.
Yes, that's 100% right. Actually, we have this, as I mentioned, drastic need for family doctor. One story kind of touched me very recently. I just got a gentleman who's 60 years old kind of approached me and said, you know what, I just had to amputate my leg due to diabetic complications. So when I asked him, okay, what about your family doctor? He said, unfortunately, my family doctor retired 1 year back and I wasn't able to find another one.
Wow.
That's kind of really give me this kind of passion, and I wanted to really do something for this community. I felt bad that, okay, a lot of patients actually struggling to find a family doctor. They don't know what's happening. And family physicians and pharmacists, they are the foundation of our healthcare. As you mentioned before air, that we are in a verge now to have a family health team, which is basically a multidisciplinary medical kind of really approach to patients. So the patient can be seen by a clinical pharmacist, by a nurse practitioner, a family physician, to be able to triage and make sure that we don't have this complication later on. So I kind of really looked around me, and now with thanks to the Ministry of Health, they actually changed the rules. So now we can really bring doctors either from USA or from UK. But unfortunately, I didn't want to go to USA because of the tariffs. So I went to UK, and there was a lot of family doctors, they were willing to come and live in Canada and really practice medicine in Canada. They're very highly qualified doctors. They've been working in UK for so long. And I approached that. I went to so many conferences in different places in UK, and I kind of really presented that how Ontario is a great place to live and a great place to really practice medicine, and that's a lot of them actually showed interest, and we were able to get 9 doctors last year from UK.
What's that conversation like? Are they really willing to make the move?
Absolutely.
Yeah.
We have a great system here. The only thing is we definitely need to really advertise about it and to make people know more about it, and that was the only link missing. So that's what I did. I just went to them and said, okay guys, you know what, in Canada here we have one of the greatest actually medical system in the world, but we just need now human resources, we need personnel. And definitely here in Canada, remuneration actually kind of pay is better than in UK, and also the way the colleges and the ministry is actually treating doctors much better than UK. That is why doctors actually prefer to come to Canada. So it was really simple for us once we promote that to UK doctors. Is highly, some of them actually been working in UK for 15, 20 years.
Wow.
And they were willing to move with their family. The only reason, the only skeptical part here is that just, okay, we're gonna move with their family. So what's gonna happen to us, like residents? What about transportation, schools?
Right.
So that's my job.
Yeah.
My job is actually to facilitate all that, to make it easier for them. I was really trying to make their move is very easy. Once they come here now, 9 of them actually, they are practicing, they're seeing a lot of patients. They saw so far almost 10,000 patients in different locations.
And now we're got about a minute left. Sure. They're going to tell their associates back in the UK to say, hey, you know, Canada's a great place. The remuneration's much better. The lifestyle's amazing. That's a great story to tell. Again, we have about a minute. Where can viewers get more information in terms of the physicians that you have under your roof?
As you mentioned, Rick, thank you very much. It's very simple. We have a website. We created a website with a landing page. It's www.samysclinic.ca. You just go to the landing page and then you choose which clinic, because we have 10 clinics. You just choose which area you want and then register, put your information, your name and your email address and your phone number, and one of our team is going to call you within 2 days.
Okay.
And the wait time is almost 0.
Wow, and that's great news for people who do need a family doctor.
Absolutely. I hope that that helped, and that we're really committed to do more with the Ministry of Health too.
All right. All those links on our website as well, chch.com/morninglive. Samy, thanks for joining us this morning.
Thank you very much, Rick. Have a great day.